Today we will talk about surgical knotting. For every doctor, it is very important to have a basic knowledge about surgical knotting. At some point of their career, it will be useful. So when we talk about the surgical knotting, knot security is very important, and the bad knotting will lead to a lot of problems and complications and catastrophes, such as very catastrophic bleeding can happen, and at the same time wound dehiscence and wound infection can happen as a result of bad knotting. Therefore, we will concentrate on how to do a hand knotting today. Let's look at surgical knotting today, and it's the hand dexterity is very important for a surgeon with regards to the surgical knotting. And remember that for a right-handed person, it's better to use the left hand for the knotting. On the vice versa, for a left-handed person, it's better to use the right hand for the surgical knotting. But at the same time, you should remember that for a surgeon, it's better to be an expert on using both hands when it comes to surgical knotting. So let's see how we put a proper surgical knot today using the hands. So first we will talk about the reef knot, which is the proper knot, and I will demonstrate that using a thread. And this has two ends, the short tail and the long tail. So since I am a right-hander, I am putting the knot using my left hand. So this is the short tail, and remember this is the first knot I am going to put, and I am holding the thread with my thumb and the fourth finger, and I am using my index finger to put the knot. So this is going to be the first knot. And remember that the two ends, the short tail and the long tail, the short tail should be in the optimum length, which is about 15 to 20 centimeters. If the short tail is too short, you will struggle when you are putting the knots. And if it is too long, it is a waste of resources. So after putting the first knot, I will just show how to put the second knot. So you should twist your hand in a supinated position, and again using your middle and the ring finger, you do the second knot. Can you see that it has nicely come as a reef knot? And you can, for the third knot, you can use again your index finger, and this is going to be the third knot. So this is just a demonstration. I have shown you the first knot, second knot, and the third knot, which have come like a reef knot. So ideally speaking, you should put at least 3 knots for the knot security. So this is the reef knot. So I will show you again how to put a reef knot in a proper manner in a real setup. So this is the short tail. I am putting the first knot and tighten it, and don't tighten too much, which will cause necrosis of the tissues. And it should not be too loose as well, which will it is not serving the purpose there. Then the second knot goes like that. Third knot going like this again. So this is the ideal 3 knots with the reef knot. You are doing the reef knot. And so in addition to the reef knot, there are other knots as well, which is a granny's knot, which is not a proper surgical knot, which means not tightened properly. Okay, let's see how to do a surgeon's knot. So with the first knot, you will go for 2 throws like that, and that will give a properly tightened with optimum tightness for the first knot. Then like previously, we will put the second knot and tighten and put a third knot. That's how you do the reef knot, starting with the surgeon's knot as the first knot. Okay, and after putting the knot, there are several other important points as well. When you are cutting the thread, remember that when you're cutting a suture material after a skin suturing, the length should be at least about 0.5 to 1 centimeters. And if it is a sort of inside, say bowel or inside the abdomen, 2 to 3 millimeters length is enough. Keeping too much will ask for sepsis, infection. And if it is too short, the knot security is not good and it will loosen. And at the same time, there are important several other points that when you after suturing, the knot should not be placed over the suture line. The knot should be towards the side rather than putting over the incision. And remember that during suturing, you should always wear the proper sterile gloves. In this case, I am not using the gloves, but in a real scenario, you should always use the sterile gloves. Okay, let's see how to put the Aberdeen's knot. Now, this is important when you are suturing the abdomen, actually after laparotomy. And so you have done the suturing of the abdomen, and after that, as the last knot, you will put a Aberdeen's knot. So this is the long thread and this is the loop. I'm holding the loop with my left hand and the long length from my right hand, and you take this through this and tighten. That is one throw, and another throw goes like that, and you will put another one, third one, going through the loop, take the thread and take it through that and tighten. So 3 knots. After that, you take the thread through the loop and pull it, and it is secured. So you can cut it from here, leaving about 1 centimeter length. So that is the Aberdeen's knot, which is important especially after laparotomy when you are doing the mass closure, closing the rectus sheath. So after serving the purpose, we have to remove the sutures. So suture removal also a skill and a technique that everybody should master. So let's talk about how to remove stitches. I will demonstrate how to remove a simple stitch as well as a metro stitch here. So for that we need a couple of instruments, a mosquito forceps, and maybe you can use either a scissor or a number 11 blade for that purpose. So when you are removing the sutures, so most of the time this may be done by the nurses, but whoever it is, either nurses or the doctors, they should be competent enough to do this procedure. Otherwise, if you leave some part of suture material inside the body, it will lead to stitch abscesses and later on some sepsis and problems. So therefore, we have to make sure that we are removing the full length of the suture. So for that, I need a mosquito forceps and either a scissor or a blade. So I'll show you how to remove stitches. This is first one is a simple stitch. So out of the 2 tails, you hold it from one end and pull it. Then you will see that the free loop, you should cut free loop with some distance from the knot, and from the knot side you should pull it. So the knot is not going through the body, it is coming outside. The full length of the thread is coming outside. So that is how to remove a simple stitch. Okay, so let's see how to remove a mattress suture. Again, like before, you hold with a mosquito forceps from one end and pull it, and I'll use the number 11 blade to cut the stitch, and you cut the thread away from the knot from one side. Don't cut from the both sides. In that case, part of the thread will be left inside. So cut only one end. After that, you pull the knot, not allowing the knot to go through the body, but the full length of the rest of the thread coming through the body and coming out, and you see the complete suture, including the knot, has been removed and nothing left in the body.